Today we will see the anatomy of the shoulder joint. First, we will see the type of the joint, right? The shoulder joint is the synovial joint of the ball and socket variety, right? And we will see the what are the articulation of the this joint. The joint is formed by the articulation of the clinoid cavity of the scapula and the head of the humerus bone, right? These are the articulation. Then we will see the stability. The coracoacromial arch or secondary socket for the head of the humerus, right? Then next one is the musculotendinous cuff of the shoulder. There is the rotator cuff muscles. There is the teres major, teres minor, supraspinatus, infraspinatus. These are called as a rotator cuff muscles. Then the glenoid labrum. These three factors increase the shoulder joint stability, right? Because of the shoulder joint is the unstable, no. That's why these three factors increase the shoulder joint stability. Then we will see what are the bursa in the joint. First one is the subacromial bursa. Second one is the subscapularis bursa. The other one is the infraspinatus bursa. The bursa is the fluid sac, right? Fluid sac. This is the prevent the friction of the joint, right? Then the absorption of the shock. These are the function of the bursa, right? Then we will see the relations. First, superiorly coracoacromial arch, then subacromial bursa, supraspinatus, and deltoid muscles. These are the superior relations. Then we see the inferiorly. What are the inferiorly? They are a long head of the triceps brachii, the axillary nerves, and posterior circumflex femoral artery. Right? These are the inferior relations. And we will see the anteriorly subscapularis muscles, coracobrachialis muscles, then short head of the biceps brachii and deltoid muscles. These are the anterior relations. Then we will see the posteriorly. There are infraspinatus, teres minor, and deltoid. These are the posteriorly. Then within joint, there is the tendon of the long head of the biceps brachii. These are the relations of the shoulder joint. And we will see the ligaments. First, there is the coracocameral ligament. That means the humerus to the coracoid process. Then was the transverse humeral ligament, right, between two tubercle, greater and lesser tubercle. There is a supraclinohumeral ligament, right? Then middle clinohumeral ligament, inferior clinohumeral ligament, right? Then the fold of the capsule of inferiorly, there is the fold of capsule. The capsule ligament cover the hold of the joint, right? Here some part of the capsule ligament. These are the ligament of the shoulder joint. Then we will see the what are the blood supply. The anterior circumflex femoral vessels, posterior circumflex femoral vessels, then the suprascapular vessels, then subscapular vessels. These are the blood supply of the shoulder joint. Then we will see the nerve supply, axillary nerve, musculocutaneous nerve, then the suprascapular nerve. These are the nerve supply. Then we will see the what are the movements. This one is the flexion, extension, abduction, adduction, the medial rotation, then lateral rotation. These are the movement, right? Then we will see the what are the clinical importance of the shoulder joint. There is a dislocation that is common, the shoulder tip pain, the frozen shoulder, right? Then the site of the aspiration of shoulder joint. The aspiration means the remove of the fluid in the joint, right, by the needle. These are the clinical important. Okay, this is the anatomy of the shoulder joint.